Did you know that the way you close your eyes at night could be the very thing that stops your heart or triggers a devastating stroke before the sun even rises? It sounds like a horror movie, but for millions of seniors, this is a silent reality. Imagine going to bed feeling perfectly fine, only to have a life-altering medical emergency occur while you are completely unconscious. Why does this happen? And more importantly, is your favorite sleeping position actually a hidden death trap? Today, we are diving deep into a warning from top cardiac surgeons that you cannot afford to ignore. Before we reveal the specific position that could be putting your life at risk, we need to understand the fragile mechanics of the human body during rest. Many people assume that sleep is a time of total recovery, but for your cardiovascular system, it can be a period of intense stress. Have you ever wondered why so many cardiac events happen in the early hours of the morning? The answer lies in the delicate balance of oxygen and blood flow. As we age, our bodies become less resilient to the shifts in pressure and positioning that occur while we dream. But what if the simple act of rolling onto your back was the trigger for a catastrophic blockage? This isn't just about comfort, it is about survival. Surgeons are now seeing a terrifying pattern where specific sleeping habits correlate directly with the rupture of arterial plaques. Think about your own bedroom for a moment. Is your pillow too high? Are you sleeping in a way that compresses your vital arteries? The danger is more immediate than you think. When you lie down, gravity begins to work against you in ways you might not realize. For those with underlying heart conditions, this gravitational pull can be the final straw. But wait, is side sleeping actually the cure, or does it carry its own set of hidden risks? We will explore that very soon. First, let's talk about the carotid arteries. These are the primary highways for blood to reach your brain. If these highways are narrowed or kinked during the night, the results are immediate and often permanent. A stroke occurs when the brain is starved of oxygen, and during sleep, you might not even realize it's happening until it's too late. It is a terrifying thought, but knowledge is your best defense. What if I told you that a common snoring habit is actually a siren song for an impending stroke? Most people dismiss snoring as a nuisance, but to a cardiac surgeon, it is a red flag for obstructive sleep apnea. This condition causes you to stop breathing repeatedly throughout the night, sending your blood pressure skyrocketing. When your blood pressure spikes while you are asleep, it places an immense strain on the walls of your arteries. If those walls are already weakened by age or cholesterol, they can give way. This is the moment a stroke begins. But which side should you sleep on to prevent this? The answer might surprise you and goes against everything you've been told. Research suggests that sleeping on your back, also known as the supine position, is the most dangerous for those at risk of stroke. In this position, the tongue and soft tissues at the back of the throat are pulled downward by gravity, narrowing the airway. This restriction leads to a drop in blood oxygen levels, forcing the heart to pump harder and faster to compensate. This nocturnal struggle is a recipe for disaster. But there is another factor at play: the alignment of your neck. If your neck is twisted or compressed, it can physically limit the flow of blood through the vertebral arteries. Imagine a garden hose with a kink in it. The water still flows, but the pressure builds up behind the blockage. In your body, that pressure can lead to a burst vessel. Why do doctors call the hours between 4 a.m. and 6 a.m. the danger zone? It's because this is when your body prepares to wake up, releasing a surge of adrenaline and cortisol. If your sleeping position has already stressed your system, this natural hormone spike can push you over the edge. You might be thinking, I've slept on my back my whole life, and I'm fine. But the risk increases exponentially with every passing decade. As we lose muscle tone in our throat and our arteries become less flexible, the margin for error disappears. Is it possible that your favorite pillow is actually contributing to this risk? We'll look at the science of pillow height and neck angle in just a moment. Many seniors find that they wake up with a headache or a stiff neck, dismissing it as a sign of aging. In reality, these could be mini strokes or transient ischemic attacks occurring while they sleep. These are warning shots from your body, telling you that your brain is gasping for air. If you ignore these signs, the next event could be the one you don't wake up from. But don't panic yet. There are simple adjustments you can make tonight to drastically lower your risk. It starts with understanding the lateral advantage. Sleeping on your side, particularly the left side, has been shown to improve circulation and take the pressure off vital organs. But wait, is the left side always better, or could it actually strain your heart? This is a point of contention among specialists. Some argue that sleeping on the left side allows for better lymphatic drainage and helps the heart pump more efficiently due to the positioning of the aorta. Others suggest that for those with congestive heart failure, the right side might actually be safer to prevent the heart from shifting in the chest cavity. The complexity of the human body means there is no one-size-fits-all answer, but there is a clear worst position. If you are a back sleeper, you are essentially playing a game of Russian roulette with your vascular health. How can you train yourself to stay on your side when you are unconscious? There are physical tools and behavioral tricks that surgeons recommend to keep you in the safe zone. One famous method involves sewing a tennis ball into the back of your pajama top, making it uncomfortable to roll over. It sounds primitive, but it has saved countless lives. But what about the role of hydration before bed? Did you know that being even slightly dehydrated can make your blood thicker and more prone to clotting? When you combine thick blood with a restricted airway and a dangerous sleeping position, you create the perfect storm for a stroke. We need to discuss the relationship between your evening routine and your overnight safety. Are you eating heavy meals late at night? This causes blood to be diverted to your digestive system, leaving less for your brain and heart during the crucial sleep cycles. The interconnectedness of our lifestyle choices and our sleep health cannot be overstated. Have you ever felt a sudden jolt or jerk right as you were falling asleep? This is often your brain's emergency response to a drop in oxygen. It is literally a life-saving reflex. But as we get deeper into sleep, these reflexes can become duller. This is why the position you choose at the start of the night is so critical. It sets the stage for the next 8 hours. Let's look at the statistics. Individuals who suffer from untreated sleep apnea are 4 times more likely to have a stroke and 3 times more likely to die from heart disease. And the supine position is the primary trigger for apnea events. It is a direct link that many people simply don't take seriously enough. But what if you have chronic back pain that forces you to sleep on your back? There are ways to mitigate the risk, such as using an adjustable bed base to keep your head elevated at a 30-degree angle. This slight incline can be the difference between a restful night and a medical emergency. Why is the medical community only now becoming so vocal about this? The technology used to monitor sleep has advanced significantly, allowing researchers to see the immediate impact of positioning on cerebral blood flow in real time. The data is clear. Gravity is a silent killer in the bedroom that we also need to talk about the silent stroke. These are strokes that don't cause immediate paralysis or loss of speech, but instead slowly destroy brain tissue over time, leading to dementia and cognitive decline. Often, these are caused by the chronic oxygen deprivation associated with poor sleeping positions. Are you sacrificing your long-term mental clarity for a comfortable night's sleep? It is a trade-off no one should have to make. Let's talk about the specific warning signs you should look for in the mirror every morning. If you notice a drooping eyelid, a slight change in your smile, or a weakness in one hand that fades after an hour, you have likely experienced a nocturnal stroke event. These are not just getting older symptoms, they are emergencies. The surgeon's warning is simple. Change your position before your body forces you to. But how do you know if you are actually at risk? We will go over a quick self-assessment you can do at home. First, check your neck circumference. Men with a neck larger than 17 inches and women with a neck larger than 16 inches are at a significantly higher risk for airway collapse while sleeping on their backs. Second, evaluate your daytime fatigue. If you feel exhausted despite getting 8 hours of sleep, your body is likely fighting for air all night. This chronic stress weakens the heart muscle and makes the arteries brittle. It is a cycle of destruction that only stops when you change your habits. Now, let's talk about the Goldilocks of pillows. Too soft, and your head sinks, kinking the neck. Too hard, and it pushes the jaw back, closing the airway. Finding the right support is a medical necessity, not a luxury. Surgeons recommend contoured pillows that maintain the natural curve of the spine while keeping the head in a neutral position. Have you checked your pillow lately? It might be time for an upgrade. Another overlooked factor is the temperature of your room. A room that is too warm can cause your heart rate to increase, adding further strain to a system already struggling with poor positioning. A cool, well-ventilated room encourages deeper, more stable breathing. We are building a comprehensive profile of a stroke-safe sleep environment. But even with the perfect room, the position remains the most important factor. If you must sleep on your back for medical reasons, you must use a wedge pillow. There is no compromise here. The elevation prevents the tongue from falling back and keeps the pressure off the carotid sinus. This small change can reduce your risk of a stroke-inducing blood pressure spike by over 50%. Think about the peace of mind that comes with knowing you are protected. As we wrap up this deep dive, remember that your health is in your hands, or rather, in your shoulders and back. The transition from back sleeping to side sleeping can be difficult, but it is one of the most effective non-medical interventions you can perform. Talk to your doctor about a sleep study if you suspect you have apnea. Don't wait for a major event to take action. The warning from cardiac surgeons is clear. The way you sleep matters more than you ever imagined. Your heart and your brain are counting on you to make the right choice tonight. Sleep safely, stay vigilant, and remember that every night is an opportunity to protect your future. By choosing the right side and the right support, you are giving your body the best chance to thrive well into your senior years. Don't let the overnight risk be your story. Take control of your sleep, and you take control of your life. The science is there, the warnings are loud, and the solution is as simple as a turn of the body. Tomorrow morning, when you wake up feeling refreshed and clear-headed, you'll know that you made the right decision for your heart. This is about more than just a warning. It's about a new way of living and aging with dignity and health. Stay informed, stay healthy, and choose the position that loves your heart back.